Hello everybody, my name is Krista. We have Claudia and Lashanika, and today we are doing a presentation on bedside shift report. So today we're going to talk about change of shift report, among other things, and how it is a critical process that must be done effectively in order to ensure patient safety and satisfaction outcomes. So as we know, we see a lot of change of shift reports by nurses done outside of the patient room, either in the hallway or at their WOWs. As we looked through the hospital's protocols and policies, we found that there is not any specific information regarding change of shift report and location. So it does not say specifically that it needs to be done in the patient's room, and it can be done in the hallway if wanted to. So a quick overview of the topic and some concerns. So patients do not have the opportunity to be involved in change of shift report because it is done outside of their room and away from them. Also, when doing change of shift report away from the patient's bedside, it does not allow for the opportunity to see if there are benefits related to patient involvement during report. In addition, change of shift report done away from the bedside could lead to discrepancies in patient care if any information is left out or inaccurate. And overall, it can just lead to patient safety being put at risk. So our PCOT question. Our PCOT question is, on the medical surgical unit, does bedside shift report compared to traditional shift report improve patient satisfaction and communication regarding the patient's plan of care within a 6-month period? So why this is important is because of the possibility that a simple intervention such as bedside shift report can make such a positive impact on a patient's care outcome if this is implemented. So now we're going to look and see what the evidence says. What does evidence-based practice tell us regarding bedside shift report? Is it a good or bad thing? What does the evidence show us here? So we did this on 6 articles. We found some evidence that does prove that bedside shift report is a good thing. So we're going to go over those 6 topics. So the first one, we found an article that is a level 3 qualitative study which attempted to find out what changes in report could improve patient satisfaction and care outcomes and overall nurse satisfaction if this bedside shift report was chosen. So over a 2-week period, 6 nurses were observed during their shift report, and it was observed through a survey and about their feelings and about the new report process. So over that 6-month period of implementation of bedside shift report, some measures were assessed and reviewed. So based on the surveys and the logs, they found that the implementation resulted in improved nurse satisfaction with communication and increased care time for patients. And patients were more involved in their care and were able to identify their assigned nurses easier, and it overall increased patient and family satisfaction. Also, they found that this type of report reduced the actual report time for under 30 minutes, which overall, reduced the time and the hospital's money.
The second study is a level 4 qualitative study, and in the study, a magnet-designated hospital with 532 beds, they identified concerns about the nurse-patient satisfaction scores and patient fall rates. And so in response, bedside report was implemented in 3 units in the hospital and changes recorded over a 4-month period. A total of 94 shift results, so 46 before implemented changes and 48 after, were observed. 64 nurses completed the pre-survey and 57 completed the post-survey. The study found that after bedside report was implemented, fall rates decreased by 24% and nurse satisfaction improved by 67%. Although patient satisfaction percentages were not statistically significant, less than 10%, the researchers found that patient satisfaction showed a positive trend throughout the study. The third article is a level 3 study that is mixed, so qualitative and quantitative in nature. The purpose of the study was to evaluate whether or not moving report to the bedside would improve the effectiveness and efficiency of shift-to-shift report. The study would measure the effectiveness of the implemented changes by looking at frequency of call-out usage, nurse perceptions, end of shift overtime, and patient satisfaction. The study was conducted on a 23-bed trauma unit in a large teaching hospital, and the sample size was not explicitly stated. All items evaluated, call-out frequency, etc., were evaluated before and after a 3-month period of implemented changes. According to the study, end-of-shift overtime minutes decreased from 6,194 minutes to 5,281 minutes, and call-out usage decreased by 33%. Nurse perception surveys found that there was an 11% increase of nurses that believed that bedside report provided information more consistent to the patient's actual diagnosis. Lastly, mean patient satisfaction surveys increased by 9.2. The fourth article is a Level 3 qualitative study. The purpose of the study was to see if the implementation of bedside shift report would improve nurse satisfaction and patient safety. The study participants were 10 nurses in a 10-bed rehabilitation unit. The survey was conducted over 60 days, with the survey provided pre- and post-implementation of the intervention. Post-implementation survey results showed that nurses' overall satisfaction score improved from a 3.5 to a 3.9. And according to the study, there was no significant change in patient safety data. The patient safety data numbers were not provided in the article. The fifth article is a Level 4 quantitative study, and the purpose of this study was to examine how the implementation of bedside report affected completion of nursing tasks and documentation. According to the study, 381 patient medical records were audited pre-implementation and 373 post-implementation. Direct observation was also used to gather data. To create results, the study measured 3 items relating to completion of simple nursing care tasks and 7 items relating to completeness of nursing documentation. The results of the study showed improvement in both completion of nursing tasks and documentation. The last article, the sixth one, analyzed for this essay is a Level 4 mixed study. The purpose of the study was to examine patient and nurse perceptions regarding bedside report. Surveys were administered to 32 patients and 70 relatives pre-implementation and 170 patients and 72 family members post-implementation. Respondents were highly satisfied with nursing care before and after implementation of bedside report, with all means between 4 and 5. Nurses were surveyed 3 months before and after changes were made in the report process. The pre-survey was completed by 148 nurses, and the post-survey was completed by 98 nurses. Survey results show that nurses' perception of report as an effective means of communication decreased from 4.04 to 3.61. Post-implementation fall rates decreased by 35% and medication errors by 50%. The study concluded that bedside report increased patient satisfaction and reduced the amount of adverse events, but decreased nurses' perceptions of effectiveness of report.
LAC-USC policies. So let's talk about some of the policies at LAC-USC. Well, guess what? There's none. But that's what actually influenced us to do this research study. So, the Arthur Hospital uses bedside report as a standard of care, but the majority of nurses do not follow it. The author will use the knowledge gained from this essay to implement into her practice and to influence the nurses around in order to continue providing quality patient care. Professional standards. Bedside shift report is encouraged by many professional organizations and agencies. The Guide to Patient and Family Engagement in Hospital Quality and Safety, created by a collaboration of organizations and agencies, such as the Joint Commission, was created to help hospitals develop partnerships with patients and their families with the goal of improving the quality and safety of hospital services. So, with this guide, it contains 4 strategies made to meet the goal. The third strategy, which has its own handbook, is called the Nurse Bedside Shift Report. This is used to implement bedside shift report. The book
for this strategy contains step-by-step information created to help hospitals implement the report process into their hospitals. The handbook also contains answers to common questions, rationales, and real-world examples of hospitals that implemented the change in their units. Many other resources have been created by different organizations and agencies in hopes that hospitals will begin to implement the report processes into their units. So, some of the findings, one in particular by the study by San Jacqueline and Sherman, was that only one of the nurses did not receive bedside shift report. And you know what? With this nurse, she was only one in which nurses did not perceive bedside shift report. So did you hear me right? This was the only study that did not perceive bedside report as an effective means of communication. All other studies showed improvement in not only communication and patient satisfaction, but also nurse documentation, medication errors, fall rates, and various nursing care tests. I was testing you guys to make sure you were paying attention to what I was saying. So let's conclude. After reviewing all the articles that were chosen for this essay, the authors answered to the PCOT question: does bedside shift report compared to traditional shift report improve patient satisfaction and communication regarding the patient's plan of care within 6 months? Can I get a drum roll, please? It is an astounding yes! So, recommendations. The author of this essay recommends that all hospitals implement bedside shift report into their units. According to Cron's, breakdown and shift report are one of the most common causes of adverse events. Therefore, redesigning shift report with this evidence-based practice is critical in order to continue providing quality care to all patients. There will be a need for education and consistent reinforcement in order to ensure that nurses continue to use this evidence-based practice. However, if hospitals enforce this practice when they will be able to reap all the proven benefits mentioned above, hospitals can use the handbook created by the Joint Commission and others to facilitate the implementation of this type of report. Thank you so much for listening. We are so happy that you guys were able to join in on this report, a bedside shift report. If you have any questions, please feel free to comment below. And we are just so thankful to have been able to do this study with you all.
Here are our references. Thank you so much for listening and have a good rest of your day.